a time of hope, a time of new beginning, a ray of sunshine, a gush of happiness, and everything beautiful. It's a sweet stress, it's a sweet pain, but all in all, it's worth it. Hello, and welcome to yet another interesting episode of Nosupela Health and Lifestyle channel. And as promised, the last time we're going to be talking about second trimester. I'll try and merge second and third trimester together. I will just try really. And you can see I am still here today. I am almost 41 weeks actually, and I might be getting an induction because baby is not coming yet. Actually, we must also know that only 5% of babies arrive at their due date. A lot of them do not arrive at their due date, but in medicine we fear that the baby should not go past 41 weeks in the womb because of stillbirth and other complications. So once the woman is passing 40 weeks, 41 weeks, we can schedule her for an induction. An induction is like giving her external injections, medication that will make labor happen, just like natural labor, but it's faster, and some women report that it's more painful. I think most women actually report that induction is more painful. Don't go anywhere, we'll be back. I just want us to settle in. If you're yet to subscribe, please subscribe to my YouTube channel and let us have fun together. This day was actually funny because I was attending a family member's baby shower, and we were told to dress. We're going to get gifts for best dress, so I tried to dress this way, so I just manage it. In case you're wondering why I dressed this way, you know. See, I may not give the one to you, but I'll give you what I have. Oh, baby, oh, you are my angel. But you are like me, oh. Show you what everything I pray for you. Oh, in my heart, it's a permanent place for you. That's on my heart till they beat like you can do. Cause I know I choose, so I am very I see for you when I be like you can do. So today I chose to wear black. Yes, black is a pregnancy act. I must tell you now. This is our 41 weeks baby bump. 41 weeks baby bump, because I'm going to put 1 week this week. So yeah. So black is a pregnancy act, especially at the first trimester, second trimester-ish, when you don't want people to really know you're pregnant and you still want to see on Instagram and Facebook, you know, just wear black. You can't go wrong with black. It's because I'm coming close, that's why you can see the whole extent of my tummy. Black makes it, if you take like a picture that is far, people will not be able to tell that your tummy is out already, you know. And of course this won't show too much, but try it. Black is a pregnancy act. So yeah. So these are some of my black pregnancy pictures. As you can see, you cannot really tell the whole extent of my tummy from that picture. Yeah, that's what black does. I was actually 4 months gone here, and my tummy was already protruding, but because I was wearing black, nobody can tell, and I could still slay with this picture. The picture went viral. Yeah, second trimester for most women is a game changer. That is when a whole lot of things happen. Trust me, that is when the body changes and all of that happens. That's why I keep saying in pregnancy women need a lot of support, especially from their husbands. So please, women, men, we have to marry our friend and marry people that will not have been there for us during pregnancy. Pregnancy changes your whole life. I'm getting my skin back a little. I was darker than this at 30 weeks, 35 weeks ish. So please, we need utmost support. So in second trimester, the bump starts to show. My bump started showing at 4 months. Yes, at 4 months. Then my navel pushed out more, and it's still out now, even till now. So that's when the bump starts to show. But for most of you, it is a glow month. I glowed all through my second trimester. That glow was real. People were asking me, did I change my cream? Now let us check some of my glow pictures that I took when I was second trimester of pregnancy. Oh my god, the glow is real. And I made these pictures myself. I could teach you how to. It's going to be on my YouTube channel very soon. You don't have to go to the studio every time to get nice pictures, you know. I'll teach you. Now let us talk about the chief hormones, the principal hormones of pregnancy. The chief or the main hormone of pregnancy are the HCG, human chorionic gonadotropin hormone, progesterone and estrogen. The HCG is usually the first hormone present whenever there is pregnancy or pregnancy has occurred, because it is produced by the cells surrounding the growing embryo or the growing fetus. Do we get? This later becomes the placenta. The placenta is the one that acts as the interface between the mother and the child. This placenta is what Yoruba people call ibiomo, the very big ones you see that they say give to the father to bury or something or throw away like that. That's the placenta. It acts as the interface between the mother and the child. This placenta nourishes, it protects the child, acts as a form of gaseous exchange, nutrients, transfer of drugs, transfer of immunity from the mother to the child by taking immunoglobulins from the mother to the child. Pardon me. So that is why you see that most times they will tell the pregnant woman that to avoid the hospital area, avoid things that can decrease our immunity more, because when you're pregnant, your immunity reduces. You are sharing your immunity with the baby. So it's very important that when you're pregnant, you eat right, you avoid infections, because your immunity is much lower, and you avoid places where there are sick people. That's why during COVID, a lot of pregnant women are advised to stay at home. They don't do grocery shopping or anything, because we know that their immunity is quite low at that time. Now let us move to progesterone and estrogen. For a woman, for every woman, progesterone and estrogen are always present with women in their lifetime, because they also regulate the menstrual cycle of women. Progesterone is the hormone that is largely responsible for irritability that women feel when they are menstruating. That's why you see that they are irritable, they are angry, they are cranky during their menstrual period. So this same progesterone now becomes the hormone that causes mood swing in pregnancy. Yes, that's why you can find the pregnant woman moody today, tomorrow she's happy, today she's sad, she's cranky, like that. That is the work of progesterone. It can heighten or lower their emotions too. My progesterone made me a very, very emotional. Small thing, you can tell me something small now that I'm supposed to actually just tell you I don't like or something, and I'll start crying. Sometimes my husband just tells me, you didn't prepare the grocery list. And then I'm like, what do you mean I didn't prepare the grocery list? Do you know what I do in this house? Are you trying to say that I'm not useful, I'm not responsible? Because I start speaking all sort of English, and it's like, oh my god, I just asked why you didn't prepare the grocery list, and it's not like I'm fighting you. So he starts begging, and just imagine if he's not an understanding husband. So my progesterone made me a lot emotional. I cried more. You can tell me if you didn't remove your plate from me and I'm crying, I just see it as, I don't know, I cried a lot during my second trimester. So progesterone, aside from mood swing, also prepares the uterus. The uterus normally is a pear-shaped organ. It's very small, but the progesterone makes it enlarge. That's why it is not when a woman gets pregnant today that stomach is boom. No, progesterone start acting on the uterus. In the non-pregnant uterus state, that's when there's no baby. It is small, pear-shaped organ. Then when it is as the baby grows, progesterone enables the uterus to enlarge. It keeps enlarging to accommodate the child. That's why this same uterus can accommodate 4 babies, 5 babies, 6 babies, 8 babies, because progesterone will act on it and make it bigger. Another function of progesterone is that it relaxes the smooth muscles of the uterus in such a way that it doesn't make the uterus to expel its content when it is not time. Now it is not time. My uterus is not expelling the content as a child because it is not time. It is the function of progesterone to make sure that the uterus is relaxed, so that it does not see the baby as foreign and then expel it out or push it out, that we have abortions happening. Then apart from that, progesterone also is responsible for constipation. A lot of pregnant women will tell you, I feel a lot constipated when I'm pregnant. That's the function of progesterone. I was constipated for like 16-17 days in my first trimester. In fact, I was scared. No fruit was working. The only food that worked for me was carrots. I don't know anybody who experiencing it can try it, but it works for me. So but I had to go to the doctor. I was almost praying for an enema because it was a lot uncomfortable. That's also the function of progesterone. So then estrogen has been blamed to be the one responsible for morning sickness. As some women, I never felt morning sickness, but estrogen is responsible for morning sickness, showing up, tiredness, and all that. And aside that, estrogen also prepares the breast. The milk duct, enlarges the milk duct, so that the breast gets bigger in pregnancy, because it has to prepare for what? Lactation and breastfeeding. Those are the function of the progesterone and estrogen. But aside the fact that they do those things, they also make a woman glow in pregnancy. When you see pregnant women glowing, it is a function of the hormones of pregnancy, such that the progesterone and the estrogen, they also make her glow. My second trimester, I was really glowing, and people were asking me, oh my god, you look sweet, you look good, and all that. And I was enjoying every bit of it. Then third trimester, it was another thing. So apart from that, there is also something that happens very important that we call cervical mucus plug in pregnancy. We'll be right back to discuss that. I like us to take short breaks, you know.
And these are times I could suck belly very well, you know. Then my mom will ask me, where is the baby? Anytime she sees pictures, I'm like, the baby is fine, come on. You know, it's nice.
So yeah, let us move to tests that are important in second and third trimester of pregnancy. At 20 weeks, there should be another scan to detect for sex of the baby. It depends on the technology and the country that you have. But here, 21 weeks, roughly, you'll be able to detect the sex of your baby. And you can get a Rogam shot for Rh negative blood types. I will explain that in another video. That's Rexus incompatibility and compatibility. That will be another video because it's expressive and I need to talk about it. Then there will be diabetes screening. You are going to have a glucose tolerance test where the woman will be asked to take glucose and your blood level will be checked. They want to be sure that you do not have gestational diabetes because it's very powerful. It's something that we should not overlook in pregnancy: gestational diabetes and hypertension. Also, at 35-36 weeks, the woman is going to have what we call a group B strep swab in the doctor's office. They want to check that there is no infection because the baby is now coming to term, and we don't want baby to come to life and there is infection around the birth canal, which can be harmful, can even kill the child. So we check for all those infection. Group B strep swab is usually done in doctor's office, painless, and all that. You might use a cause or not. And then from 37 weeks, 38 weeks, there will be weekly cervical check. That is when the woman starts going to the hospital every week to see a doctor. Then at around 36 weeks, you can book for the last scan to know baby's weight, to check the pelvis. We want to be sure that the pelvis is adequate for the birth to happen. We want to be sure that baby's weight is not too much for mother to push out. As much as you eat healthy when you are pregnant, don't eat too much because big babies, large babies, that can result in CS. In developed countries like this, it's cesarean section. We don't even want to argue it. So, but for Nigeria, some people can say, I want to try, but you're going to have a lot of tear and episiotomy and all that. So, when I talk about postpartum, that's after baby comes, I will talk about episiotomy, I'll talk about induction, I will talk about breastfeeding, and it's all going to be very, 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 very interesting. So, above all, for third trimester, the major thing that happens is that the mother is tired. At third trimester, you're younger and pregnant, you start feeling low down, just want baby to come out, because some people start reporting back pain that we call sciatica in medicine. The back pain is usually very strong and painful. They can't sleep, they can't turn, the bump has enlarged. But it varies from women to women. I was able to sleep all through my pregnancy. I never had issue with sleeping or positioning. I never had back pain. But a lot of women report back pain at late third trimester, which is usually very, very bad for them, you know. But what I had was the wrist pain. I had I've forgotten the medical name now. When I remember, I'll tell us. That's what I had. In fact, it just left. It was there for like over 8 weeks. I was battling with wrist pain instead of back pain. That's what I had. Then I have some pains too. Sometimes my anus will be paining me, and I'm like, anus paining me. So it comes different for people. But when I do exercise, but we should note that this pain actually leaves us with exercise or change of position. So you can't say because I'm having pain you want to just lie down. It will keep getting worse. You should do your chores, you should move around, do exercise, and you'll be good. So the third trimester is always a tired trimester. You just want baby to come out because baby now, for baby, the baby will have grown larger or bigger, such that there is no more space and room for him to really move. But the kicks are more, the kicks and punches are more. I have a video of my baby that I put a cup on my tummy and was throwing the cups away. I might have the video to this. So the kicks are more, but the movement reduces. But in as much, you should know your baby's pattern and be able to tell when anything is wrong or not. You should get apps, pregnancy apps, so that you do your kicks counter. There's something we call kicks counter. You can count baby's kick and all that. So I'll see you when I talk about postpartum and delivery and the rest of them. I hope you had a good time because I did.